This training presentation illustrates methods for radiation contamination control while providing pre-hospital emergency medical services. There are 8 combinations and permutations for chemical, biological, and radiological contamination. This presentation does not address methods for providing pre-hospital emergency medical services for patients contaminated with chemical or biological agents. It is limited to locating and controlling radiological contamination without any chemical or biological agents. In a situation that involves mixed contamination, using your standard operating procedures for the chemical or biological component of mixed contamination will be adequate for dealing with the radiological component. Remember, radioactive contamination does not dilute. When possible, it needs to be trapped and lifted or removed, never flushed with copious amounts of water. Reggie has been a valuable member of the Benton County Emergency Services team for about 20 years. I believe he studied with Penn and Teller and seems to have adopted Teller's mute persona, but at Benton County Emergency Services we can't be sure because Reggie never speaks. Reggie seems to have come into contact with radioactive materials. That's not necessarily a bad thing, but don't count on things staying okay with Reggie around. Well, dang! Reggie has fallen, is surrounded by radioactive contamination, and can't get up. I really don't think the position of that foot is part of a legitimate yoga exercise. It looks like Reggie needs pre-hospital emergency medical services, that he's laying in a contaminated area, and that there's a strong possibility that he is contaminated. His medical condition needs to be evaluated. He needs to be checked for contamination. He needs a quick, gross cleanup, and he needs to be prepared for transportation. Before going too far down this radiation rabbit hole, you need to protect yourself. Get a dosimetry kit out of a medical unit or battalion chief vehicle. Take the contents out of the pouch. You should find a briefing sheet, instructions, a direct reading dosimeter, an optically stimulated luminescent dosimeter, and potassium iodide. Read through the briefing sheet and read through the instructions. Look through the direct reading dosimeter to get its initial reading. Then turn to page 7 of the instructions and fill in the requested information. Put on the dosimetry. Attaching it at chest level is preferred. The OSL dosimeter can be worn inside or outside your turnout gear. The direct reading dosimeter needs to be readily accessible so you can check it to measure any radiation exposure. There are radiation survey meters on medic units that can be used to locate and measure radioactive contamination. Attach the wand to the instrument using the supplied cable with bayonet connectors. Make sure you put the batteries in the instrument. Good batteries will drive the meter indicator into the bat test area on the meter face when the selector switch is turned to the bat check position. Failing to put the batteries in the meter can really embarrass you in front of the FEMA evaluator. An operations check needs to be performed and documented prior to meter use. After completing the operations check, turn the meter setting to ×1 for surveying. If the meter pegs out on a particular setting, change the selector switch to the next higher setting and push the reset button. Put on 2 sets of gloves. Remove and replace the outer layer of gloves if it becomes contaminated when you're working inside the contaminated area. You are going to be walking inside an area that is contaminated. Protect your shoes by wearing some form of shoe covering. Covering the probe is optional. If you aren't a professional radiation worker, covering the probe is strongly encouraged. Make sure that the covering fits tightly and doesn't have loose parts that may drag on the contaminated surface while surveying. Tape is a good way to hold the covering in place. If you put the probe face down in the holder on the Ludlum, it is easier to self-survey your outer gloves when the instrument is sitting on a flat surface near the patient. There's nothing new here, just get her done. Pick a spot near the patient. Use a barrier to trap contamination on the ground or floor. Use it as a clean area to position tools and equipment. If an item is removed from the clean area for use on the patient, it does not get returned to the clean area. Have a member of the entry team who never touches the patient hand items from the clean area to the person who will use them. Use your Ninja Jedi EMS skills to evaluate the patient's condition. If the patient has life-threatening injuries, treat and transport without regard to contamination control. If the patient does not have life-threatening injuries, take your time. Check your outer gloves for contamination often and before touching a different area of the patient's body. If contamination is detected on the outer glove, remove and replace the outer glove. Now it's time to fillet Reggie out of his contaminated clothing prior to packaging him for transport. Gently cut, do not tear, the outer layer of clothing beginning near Reggie's head. Roll the clothing away from Reggie to trap the contamination inside the roll. Roll Reggie onto his side to move the clothing farther underneath. Then roll Reggie onto his other side and remove the rolled contamination outer clothing from underneath Reggie. Before transporting Reggie, survey him for contamination. At a minimum, survey for and document any contamination found on Reggie's head, face, and around his nose and mouth. And survey and document any contamination found at common sites for IVs on Reggie. If there is contamination on his face or common sites for IVs, consider using non-intrusive decontamination methods. For instance, if you find a small spot of contamination, try using the sticky side of tape to remove it. This method isn't effective for larger spots of contamination. Or use a wet wipe to gently clean the area that's contaminated. Isolate the contamination if you can't remove it by taping gauze or other covering over it. Gloves or plastic bags could be used to cover contamination on his hands. Prepare a clean area for the backboard near Reggie. Place the backboard on the clean area. Cover the backboard with the edges of the cover close to the edges of the backboard. Now it's time to use your Ninja Jedi EMS skills to levitate Reggie onto the backboard. Once he's on the backboard, extend the backboard covering over the top of Reggie to trap any residual contamination inside. Use tape to secure the cover if you wish. Carry Reggie to the warm-cold boundary. Hand him over the boundary for placement on a covered stretcher. Cocoon Reggie again using the covering on the stretcher. Load Reggie into the medic unit and transport him to the hospital for decontamination and treatment. Go to the location designated by the hospital for receiving contaminated patients. Brief the receiving hospital staff about Reggie's medical condition and extent of contamination. Give them any documentation that you have for the contamination and its locations. If needed, you can return to the same scene to transport additional patients. After all patients have been transported from that contaminated scene, you are out of service until you and the medic unit are surveyed and pronounced clean. After you have been surveyed and decontaminated if needed, obtain and document the final reading from your direct reading dosimeter. Turn in your dosimetry and expose your form from the kit instructions as directed by your supervisor. Later you will receive a report concerning radiation exposure recorded by the optically stimulated luminescent dosimeter. If you have any questions or comments about this training, please contact me at the listed email address.